Hi, good morning. My name is Andrea Alcaraz. I am the Health Technology Assessment Coordinator of the Institute for Clinical Effectiveness and Health Policy in Argentina. I'm very sorry I'm not be able to be there in person, but I am really happy to share this workshop with you. Now, I'm going to talk about the influence of HTA on technology incorporation in Argentina. IEX, my institution, is a non-profit independent institution dedicated to research and education and to providing technical assistance to health policies, programs, and intervention. We have projects all around the world, and the HTA agency is a whole collaborating center, is one of the founding members of REDETSA, the first Latin America agency to become part of INNATA, and a Latin American reference HTA agency. So, first of all, I'm going to talk about the health technology cycle. You know that when a new technology is emerging, first is a research and development period, and then they go to the experimental technology and innovative technology, then it's going to general use, and a time later is going to the obsolescence or replacement. And HTA, it could be used in all these stages. And also it's the same situation into the hospital. But what is the usual process of incorporating new technologies into the hospital? The donations, the direct purchase without evaluation, the direct purchase only with financial evaluation, or the formal HTA process into the hospital. In Argentina, donation and direct purchase without evaluation are the more popular ways of incorporating new technology into the hospital. The common arguments for purchase in different countries of the world relevant from INNATA, they are the same that in Latin America and in Argentina. The hospital in front already has it, and it has been done in many others. It will give us prestige. It will give us research projects. It is proven without evidence that is the best option. We avoid discomfort and movement to the patient. We will save costs. In Argentina, it's the same common arguments. And who is involved in this process? Into the hospital, authorities, executive, heads of service, but also there is an internal pressure because healthcare professionals are trying to incorporate the new technology. And there is also an external pressure because society, pharmaceutical industry, patient association are trying to incorporate new technology. And all the actors maybe could take some conflict of interest. And we have a problem, we cannot evaluate all health technology together. We need to have a prioritization process, and it is difficult to select which technology evaluate in the first stage. So, maybe those that are expecting to involve changes in the service offered by an institution, it could be a good candidate. Or because they are very new, or their indications are extended in relation to the known ones, or they are used widely and very differently between different service or professional. This is an inappropriate variability in the use. Or those that are very expensive and will have a big impact on the hospital budget, or because require specific equipment, products, or training, or involve structural or organizational changes in the hospital. So, and what are the steps to incorporate HTA-HB in Argentina? First of all, we need to identify the actors. and identify the people to realize the HTA. And then choose an appropriate circuit and choose an HTA model. And when all is functioning, testing the selected process and establish one cycle of continuous improvement. So we know the actor to be involved. It is preferable to incorporate them into the process of HTA into the hospital because they are going to be part of the decision. And how about the people? The people, they need to be professional trained in the search of scientific evidence and coverage policies and in the critical reading and synthesis of available evidence. And they need to be time to be assigned for this mission. And they need access to information and a really well knowledge of the local context. And how about the circuit? The circuit is going to be selected and depends on the hospital, but we can simplify in this process. A first process of assessment, and we are going to answer this question. Is this technology clinically effective in relation to the gold standard? Is this technology cost effective? Is appropriate for our setting? Should we acquire or introduce this technology? And we are going to perform a recommendation. Yes, implement it. Or no, do not implement. Or maybe yes, but with some condition in some kind of patients or negotiating prices. So there are two separate processes into the same circuit, the assessment process and the appraisal process. So we are going to move to incorporate HTA. Okay, but HTA into the hospital or HTA with external consultation? It's a decision that we need to take it. If I prefer to incorporate the process into the hospital, we need to choose one model. And there are a lot of models that are described, and we need to select according to organizational complexity and focus of the action. And if we have the ability to perform a team group unit, or I only have one individual, one person that is going to work in this process. So we need to think about which is the best model for my institution. In Argentina exists HTA into hospital. There are very few institutions that really implement it. There are many others trying to implement it. But two public institutions, the Garrahan Hospital and El Cruce Hospital, and two private, the Austral and the Aleman hospitals, are really working hard in this process. And the Garrahan Hospital was the first one that they have 12 years of experience. They have a really good, strong hospital circuit. I'm not going to take deep into this slide, but they have the circuit, and they are performing reports. They have 18 HTA reports and 12 guidelines, and the HTAs are focused on the incorporation of new technology and the guidelines to put this technology into action into the hospital. So they are the winner of Argentina because they have a really strong process. But there is other possibility because we said we have two different processes, one from assessment and one from appraisal. So we can go for help outside the institution if we have not the possibility to go into the hospital. And this is the situation of my institution. I am from IEX, and we have a consortium of public, social security, and private healthcare institutions, and we have 25 hospitals from Argentina that request HTA reports to YEX, and we generate the report and put the report into the database that is available from all these more than 50 institutions. And we have a lot of products, as can you see, and we work in diagnostic tests, in procedures, in drugs, and also in devices that are a widespread of technology that are trying to incorporate into the hospital. And they have the possibility to go to the web page and look for some report that it was performed related to the technology that they are trying to incorporate, or they have the possibilities to ask for a new document. And we have different type of documents. We have a rapid review informs, we have systematic review, we have reports oriented to coverage policies, and we also have products related to one single patient product that is they are performed in just 48 hours because they need to take decision quickly. So, in this process, the hospital is commitment to us to perform the reports, but they need to adapt to the hospital because they have the local context and the budgetary impact that we don't know. So it is a mixed process. So in my opinion, what are the main challenges in incorporating HTA in hospital in Argentina? The trade-off between response times and decision making is very important. I told you that maybe they need to respond in a very short period of time. So we are trying to implement some reports that are very, very quickly, and some reports that are oriented to general decisions that are more profound, and we have a widespread of different reports trying to fix this problem into the hospital. And also innovative technologies and looking for a strategic positioning is a main challenge in incorporating HTA. And the cultural barriers. The professionals usually have resistance to this process because they always incorporate technology because they only ask for this. So now they need to present some really strong information, and they are not in a good position related to the process. And also we can select a really good circuit, but there are alternative circuits that are trying to push to incorporate technology, and also existe donation that works like a Trojan horse because once the technology is into the hospital, it's really difficult to go outside this decision. And it is really important to have generate capability for methodological evaluation, and the relationship with the industry is really delicate into the hospital. And there are a lot of conflicts of interest of a lot of people that are actors in this process. So, some tips. The importance of structuring the process in an appropriate way for this hospital. Because we need to understand which is the situation and which is the best way to establish the circuit. And it can be a multidisciplinary process. We need not only a health professional, but also we need facilitators, an economic team, and we need to select and prioritize of the technology appropriately and have a really good qualification team, and also the commitment of directors. So, in conclusion, the implementation of HTA-HB provides the evidence required both at the level of decision making by the authorities of the center, as well as professionals in the practice of care, through a transparent and fair process consistent with the needs of each institution. And both model with external consultation, mainly for small institutions, and within the hospital, mainly for large institutions, can coexist and complement each other. So, thank you very much for your attention. I apologize for my bad English, and I expect that you could incorporate this concept into your hospital, and I'm really happy from this presentation, and I wish you enjoy the meeting and good stay in Rome. Bye bye.